top focus story this Saturday morning continues to remain the viral fever deaths being reported in western Uttar Pradesh. Over 60 people, including 50 children, have died in western Uttar Pradesh in the last 10 days from what government authorities are calling a dengue hemorrhagic fever, or a severe fever that is being caused as a result of dengue. Now, Firozabad is the worst hit. Other districts in western Uttar Pradesh like Mathura, Agra, Hapur are also affected, and many hospitals in many parts of the state are actually full, running out of beds. The really unfortunate part of this story is the fact that children are the worst affected. Overnight, there are several COVID facilities now that have been converted into pediatric hospitals for emergency care for little children who are suffering from this viral fever. Firozabad, Hapur, Mathura, Bulandshahr are the worst hit districts. While the official estimated death toll is over 60, a reporter on the ground, Meher Pandey, telling us that the death toll could actually be much higher. So this is the big story that we're tracking. And meanwhile, we've seen that the Congress has hit out at the Uttar Pradesh government for the fact that it wasn't prepared, and the fact that COVID has actually not taught any lessons because the healthcare infrastructure is still struggling to cope with this new viral fever. Ghanshyam Tiwari, spokesperson of the Samajwadi Party, and Dr. Sarjeet Singh Dang, former minister and leader of the BJP in Uttar Pradesh, join us on the broadcast. Dr. Dang, I want to first ask you, your response to the criticism that is coming your way. It does look at the moment that the UP government was once again caught off guard as far as these viral fever cases are concerned. Hospital beds are running full. Makeshift facilities are being set up as a last resort measure.
See, it's quite unfortunate, and then it was all of a sudden, and still it is a secret disease. We don't know what is the cause, and as a matter of fact, we have to admit it because so many surveillance teams from center and from UP, both the center and the UP state, they are searching the cause. What is the cause? And then it takes time. And we were perhaps, because of this corona, which was prevalent in the last 1.5 years, I think we were caught unprepared. But the basic cause, as a doctor I'm telling you, the basic cause is because the hygienic level in our state are all over India almost. It is not up to the mark. And then these things they take time to understand and cure the disease.
Right.
No doubt, because
you're absolutely right. You're absolutely right that it is linked to hygiene levels, poor sanitization, water being accumulated. This is the dengue season. It comes with the monsoons. But my question to you is different. My question to you is the preparedness of the healthcare infrastructure in Uttar Pradesh to be able to deal with a viral fever or COVID-19. It's found wanting.
See, it is very difficult. As a doctor, I know the practical problem. It is very difficult when something mysterious comes out and we are not able to work out what is the cause. Unless the diagnosis is made, the treatment and other parts, which are very important to save the patient, is very difficult, very difficult. So practically, unless we know the cause, but no doubt that the hygienic level has a role to play. I'd like to remind you, in Gorakhpur, so many children used to die in the past. The cause was detected, the hygienic level was improved, and now the conditions are far, far, far better. So that way, it is no doubt we cannot run away from the responsibility of cleaning the whole country. And the central government started the Swachh Bharat Yojana.
But with due respect, I appreciate the fact that you're acknowledging the shortfall. My question, however, is about the preparedness of the healthcare infrastructure, the availability of beds, the condition of our primary and secondary healthcare infrastructure to be able to deal with the onslaught of any of these cases, whether it's a dengue hemorrhagic fever today or whether it's the COVID-19 pandemic. Ghanshyam Tiwari, it's the same story that repeats time after time. The healthcare infrastructure on the ground is found wanting in the time of a crisis.
Good morning. I think the story starts with the leadership. If you review the news that is emerging, Amar Ujala has reported that over 100 people have been impacted. More than 75 died in Firozabad itself. And it's devastating that many of these who died are children. Now, there is no report of the Health Minister of Uttar Pradesh taking any action, or the Health Minister of India taking proper cognizance. The only report that says that the UP Chief Minister has acted tough and he has replaced or transferred this officer or that officer. That is the only response. It's a media response.
No,
the only response that the Chief Minister has is a media response. The question is that at a time when the world is talking about a third wave in COVID itself, and children are susceptible, every state should have an instant response team on any illness that affects children. There is no such instant response team that Uttar Pradesh has. In fact, for a long time, BJP on various platforms has been patting its own back, saying that, look, the COVID numbers in Uttar Pradesh is low and the COVID numbers in Kerala is high. Kerala model has failed and Uttar Pradesh model has passed. If the entire job of a chief minister is to build his own propaganda and only look at elections, will changing the name of Firozabad to something else, Adityanathbad, will help the state? No. The state has been sleeping at the wheel.
Dr. Sarjeet Singh Dan, you want to respond to that? Those are fair points. I mean, those are fair points that the opposition is making, because the truth is that the Uttar Pradesh government has patted itself on the back for its COVID-19 response. But the truth is that the healthcare infrastructure is not being able to handle this new viral fever.
See, it is when anything which unexpectedly comes, and you don't know, you don't have any history, past history of such a disease. In that case, as a doctor, I have not seen a case, but the symptoms which have been described to me, it seems to be a sort of encephalitis. The brain is affected finally. So it has to be diagnosed first. We have to know the cause. Unless we know the cause, we cannot treat.
Sir, the question is not about understanding the cause. Nobody is questioning the wisdom of doctors.
Please listen to me.
The question is about having the medical infrastructure. Do we have enough number of beds to be able to deal with the onslaught of any disease, be it COVID or be it a viral fever like what we are seeing?
It depends upon the area where the disease is prevalent. Now, if it is in a rural area, we don't have any preparedness anywhere, all over India, any state. So, the problem is that how to tackle it. And then it has nothing to do with the elections, nothing to do with anything. You see, as my friend has alleged, that keeping everything, always thinking about the elections, that has nothing to do with elections. It is unfortunate. How can we think in those terms? See, it is the children are to be saved, the patients are to be saved. That is more important, and the government is doing its best. There is a nodal officer which is making surveillance in house to house, and then the central team has come and they are investigating what is the cause.
But with your own admission,
we have to do, a government can do only to a certain extent.
No, I really appreciate you being honest about the fact that the rural healthcare infrastructure is not an Uttar Pradesh problem. It's a pan-India problem. Ghanshyam Tiwari, is it fair to single out UP? Is it fair to single out UP because this is a pan-India problem? Had this viral fever outbreak happened elsewhere, we would have seen the same scenes.
Who were previously, looking after this state, what have they done? They have not made any infrastructure in the past.
Ghanshyam Tiwari, respond to that. Does the opposition really have the right to claim high moral ground here?
On 2nd August 2021, news headlines across the country read, योगी सरकार बदलेगी एक और शहर का नाम, फिरोजाबाद का नाम चंदरनगर होगा. This is the only agenda of Yogi Sarkar. And to say that opposition has not done the hospitals that were used by COVID.
No, you are making the agenda of this Sarkar.
Time frame.
And you know better than even Yogi. You want to claim it.
Not a single hospital in
what Akhilesh was doing. What other governments in the past were doing. Have they improved the infrastructure in the rural area? We have done it. We have tried to improve it. You did nothing.
Now let's respond.
And just you blame and you say next election. How can you do it? You are so careless about the health problem. Very careless. It's a callous attitude.
Respond.
We should understand and discover that we have weaknesses.
Okay.
Those weaknesses are to be rectified.
All right, Doctor, let Ghanshyam Tiwari respond.
I repeat, on 2nd August, the headline ran from Yogi government that it is going to change the name of Firozabad. So to say that the Yogi government doesn't care about election and is prepared are two foolish statements to make in the same sentence. The reality is that this government only cares about election. They don't care about health. They care about hatred. That is the essence of Yogi government in 4.5 years. They have not built a single hospital, not one hospital. They promised so many aims in their 2017 manifesto. They did not do. What is a
7 new medical colleges have been there, and they're all associated with hospitals.
Has not made a single
and so many new hospitals in the rural area and in the urban area to have been started.
All right. Well, the blame game continues.
And don't criticize.
The blame game continues. It's the same story that plays
out.
out. All right. Dr. Dang, you've made your point. Ghanshyam Tiwari, thanks very much, both of you, for joining us. The same story continues. The same blame game essentially continues. And all of this while lives are being lost, young children being affected by viral fever, not finding beds. There is no ambulance services to transport bodies. We will continue to bring you all the very latest from ground zero. My colleague Meher Pandey is there in Western Uttar Pradesh's Firozabad district, which is the worst hit. And we will track this story from ground zero and get you all those reports on what is happening in Western Uttar Pradesh as far as this viral fever is concerned. Was the state administration caught off guard?